Hello and welcome to a new episode of the show. I'm your host Rida, and this is the Psyche in Human Body podcast. My guest for the day is Dr. Renata Von Kouh. Dr. Renata will be discussing the connection between the gut health and mental well-being. In addition, she will be explaining the principles of osteopathy and how it can help in relieving the pain and promoting the healing, basically. In addition, Dr. Renata will be introducing us to a new therapy that is called the ANF Therapy treatment, which is basically a frequency imprinted discs to reduce the inflammation and restore the organ functions. I hope you enjoyed today's episode as much as I did from the information which Dr. Renata have presented. Many of the things that she have spoken about are things which I have heard for the very first time in my life. Please leave all your comments in the comment section below on whatever platform you are hearing this, either Spotify, YouTube, or Instagram, and I'm going to make sure to answer all the questions. In addition to asking Dr. Renata if you have any questions about the therapies, and let's get to it. Thank you very much. Renata, how are you?
Good evening. I'm good. Thank you. How are you doing?
Good. Thank you for asking. Let me start the conversation by thanking you for the invite that you accepted it. I really do appreciate it, and I'm very grateful for your time today.
No, I'm the one who'll be thankful. Thank you for letting me share a little bit of everything that I know and I've been through. And congratulations for the work you're doing. Like, we need more people like you. So thank
Thank you so much, Doctor. Thank you for your kind words. Let me start off the conversation by just Dr. Renata introducing herself. What's your backstory? What's your experience? Please tell us a little bit about yourself.
Sure. How long do we have here? We have
Well, we do have an hour, so let's start.
Well, my background came from suffering myself with health issues since a very, very early age. And so at 10 years old, after a major surgery and being 2 months in hospital, I decided that my journey will be to find a way of relieving pain. So I said to Mom, I don't want people to be in pain, and I'm going to do everything I can to relieve pain from others. So that's the passion and the gift and the call from God started. So I then decided to study medical school and see where I would go. From there, path has changed. I went into physiotherapy because I felt like, a lack of, on my journey, on my healing journey, a bit of a lack of someone holding my hand and walking me through the healing, not just surgery and done. So I thought physiotherapy would give that, and indeed it gave me a good path. So I did physiotherapy, and through physiotherapy, a lot of did masters and background in Pilates and fascia release through Pilates movements. Until I get into a point that I felt a bit stuck again, and I felt like I need to know beyond that why some patients is still inflamed or is still chronic. I can just alleviate the pain them for a day and then they're back. So I was in Dubai at that time, and I was working in an osteopathic clinic, and I discovered up visceral manipulations and how releasing adhesions and scars will make a difference. So I took the course to go through osteopathy, and then did my doctorate in osteopathy. And falling sick again in 2015, I found the call for more help, and I found neurofrequency therapy. So today I'm a ANF ambassador and instructor in the UAE and teaching in Brazil as well. So into neurofrequency medicine.
Wonderful, doctor. Let's start with the basics. What is osteopathy?
That's a good question. A lot of people ask, what is osteo? What's chiro? What is the difference?
Yeah, because I actually never knew about it before I met you.
Yeah, basically osteopathy came from an MD doctor, Dr. Andrew Taylor. He found out that the body has an amazing power to heal if you give it the right tools. So by finding out where the body is holding tensions, where the stuck areas are, we can help the patient to heal. So it basically involves many things like a craniosacral flow. He found out that actually the bones into our cranial, our skull, it moves. And he creates a whole new world from that. He believes into that the not only we have this cranial movement which pumps up our cranial flow, but it's also the visceral. So all the organs has a bigger connection, a deep connection. They need to be flowing together and talking together in order to a perfect health. So basically osteopathy is we call osteopathic medicine, and we basically find ways to heal, to give the tools to the body to heal. And that can be through spine adjustments, high thrust. We can be just by guiding and do gentle mobilizations, craniosacral flow, just by holding the skull and letting and guiding the body to do its work, and visceral manipulations and so on. Sorry.
I see.
That's
Dr. Osteopathy, can it heal, let's say, the mentality, or is it more of a functional kind of healing?
sorry. Say your question again.
Yeah, because like you mentioned that you sometimes do like a functional manipulations for the visceral on the spine, etc. So is it a tool to heal the functionality, let's say the hardware of the body, or is it a tool that we can use to heal our mentality and the software in a sense?
That's a good question. It's a good way I compare as well. You know, we have the hub and we have the whole way, and they always work together. It's very hard for us to differentiate. You know, a lot of as you say, mental health and anxiety, panics, and many things that we're living on a daily basis now. It's very much related to our gut. So you know, I normally say when we are inflamed, and we talk about invisible inflammation soon, but when we are inflamed, we are sending a energy that cannot be proper read. So it's like you're putting a 220 volts in something that can only read 110. So this needs to be talking, and it needs to be together. Whenever there is a trauma, either emotional trauma or a disease or a surgery or what it is, these frequencies can be cut and changed. And so our main goal with all the therapies that I do is to reconnect and making sure the hub and the software speaks.
Wonderful. What's the relation between the gut and the brain?
Um, I'm loving this. I told
Because
you you're
like
gonna be here.
you mentioned the
We're gonna
gut,
be
that
here
triggered
forever.
something in my mind.
Yeah, you know, I always joke, in a way, because I remember from early age, the doctor said I have my gallbladder removed when I was 10, and they said you don't need your gallbladder, and I say, how come we don't need? Because God put it there for a reason. Oh no, don't you worry, you're gonna be fine. And I was thinking, okay, you know, the girl on the room beside me needs a heart, and I just need to, you know, she's waiting for a donation, and I can just remove my gallbladder, I'll be okay. But after that, I was never okay for so many years. I was never okay. And nowadays, when I hear these patients coming in, and I keep saying, like, go and remove your gallbladder, and then we come and talk, you know. And then I started to realize the connection, also emotional connection of each organ. So gallbladder is really responsible for making decisions. And even from this aspect, I can see how much it's changed. So it's a huge connection. It's a huge connection, and every nerve and every part of our brain has its. In osteopathy, we see as well the spine, and we see each area of our spine will correspond to a different organ. So we are all wired together. I mean, it's impossible to have a good brain and a functional brain when your gut is messed up. I normally joke that I believe that the gut is actually our first brain. It's impossible someone who had a bad bloating, gas, and inflamed or and actually abdominal pain think properly. You can't.
I see. So the question now lies is, what can cause problems in the gut?
Okay, now we're going to stay here.
So
Well,
staying here the whole night.
yeah, that's lots we can talk about, but there is many things. I mean, first of all, we're living in a world that, our environment, we never been so exposed to chemicals and radiations as we are nowadays. I mean, we actually, we fighting to live with a quality of life and be healthy, because nowadays it's actually hard to be healthy. But it's even emotions. We are in a world that it's asking more and more of us. The speed we communicate, it's it's so fast, and everyone expects results, and everyone expects answers like that. And it's a lot of information, is a lot of input for the body itself to get it. So this all can create inflammation on the gut and emotional trauma in ANF therapy. As osteopathy, our main thing is correct it and it's fix emotions. So work on the emotional traumas. We normally say that we cannot heal a body if the body is stuck into a trauma.
I see. So emotional traumas and let's say depression, anxiety, and such, can we treat them by treating the gut?
Definitely.
How so? Like, is it because when I think of the gut microbiota, I think that what we eat affects it. Now, in a sense, from what I understood from you, it also affects our mental state. Is that true?
That's true. So, if you go into that, what they say nowadays, the leaking gut.
Yes.
Yeah, because it's everyone here, and it's so common. You have a leaking gut. Well, it's actually leaking. So things that shouldn't be outside on the bloodstream, it's in there now. So that will all create this. Again, remember, our brain is sitting in the lymphatic, which carries the toxins and are able to clean the body at night. And whenever this lymphatic system is it's poisoned with toxins, the toxins are not going out of the body. It's overwhelming. It's again the circuit, the hub. It's having too much electricity, and it's end up creating this whole symptoms of anxiety, panic attacks, and so on. So it's a must for a person in order to good mental health needs to have a good gut, and vice versa. It's both ways through.
Doctor, for those who don't know, like, what is leaky gut and how does it start? Is it solely related to the inflammations in the body, or does it have any other causes?
Yeah, I mean, I believe in the ANF, the amino neurofrequency. For those who know, we all based into understanding that everything in our body starts with inflammation, and this inflammation can be created, as we say, by emotions. Number one, chemicals, the food that we eat, sugar. It's one of the most poison things and the most addictive things that can come into our body and create massive destruction. So the leaking gut is nothing more than the permeability and the walls of the intestines. So the intestines needs to be sealed, and everything that we eat digest and then goes all the way out. Now, when we are inflamed, the acidity changes, the microbiota changes, and this wall that should be really united to close together and create the movement to pass the stools out, they're starting to be open because of the inflamed. If you see a fabric that you're constantly pulling and pushing and throwing a detergent that is too strong, you're starting to have that big lacky elasticity, and then suddenly you have an intestine that's supposed to be like this and it's like that. So the permeability is starting to change, and then we're starting to have this leaking change. So the exchanging material that shouldn't be happening is starting to happen, and then you have poison into the system.
Thank you so much for clearing this out, doctor. You mentioned the ANF. ANF, sorry.
ANF,
what is it?
So ANF, it's lifesaver. As I said, in 2015, I had this major surgery. I had septicemia. And I started to ask for pain management because for 2 years I have done everything you can imagine, from, the traditional Chinese medicine. Everything worked a little bit, but nothing was able to help. And for 30 years I had questioned the doctors, why do my body create stones? Why do I have this? Oh, genetic. Okay, but no one in the family has that. So I started researching, and I found aminoneuropfrequency. And they said when nothing else helps. And it's basically so true. So Dr. Mikko Hoffman, he found out that everything starts with inflammation. We already know by ages ago, like 100 years ago, we have the ECG and we have so we already know that we can read waves. So our brain has its own waves, the heart has its own waves. And he studied so deep that he found each organ has its own frequency, and the organs, when they talk together for different functions, and I give you the example of the liver and the gallbladder, they have a different frequency when they are working together. And so Dr. Mikko said whenever we have something more than 72 hours, it's become chronic. So we come out from the acute to be chronic. Now, if this chronic condition is not treated and not reversed to optimal frequency vibration, you have to deal with that. And then our body, in order to deal with it and keep functioning, it will compromise other functions. So that's why you see patients coming, oh, now I have PCOS and I have glucose intolerant and I have foggy brain, and they come with a box of medications and nothing actually is working because these connections are disconnected. So aminoneuropfrequency are discs, deoxycarbonate, which was actually NASA technology. And Dr. Mikko got in touch with them. They developed some discs. I have some here. I can show you. And so basically these discs, they have frequency imprinted on them. So it goes from hertz to gigahertz. They're like this. Yeah. We have about 300 frequencies by now. And so whenever we put the frequencies, positive, negatives, vitamin C, whatever, we're using dopamine, we basically showing the hub how to vibrate. So we enhancing the synapses and the connections and make it work stronger. So we started decreasing inflammation. So the first ones are pain and inflammation, and then we go deep into organ functions and blood flow, increase of nitric oxide and whatever, you name it, so it can fix.
Doctor, how, let's say, efficient it is in fixing compared to the common ways of treating such illnesses?
Yeah, I mean, the amazing thing of ANF, it's search for the root cause, and a lot of things, and I tell from my experience before finding, I started treating patients with ANF in 2017, and we actually help the body to realize there is a trauma, let's say a frozen shoulder, and we try to break that adhesion, and we create a bit more inflammation so the body can work in that again. but it takes so long. It's so painful for the patients, and it's not always there. Now, whenever we put this, because it's unbelievable, I can share you after some interesting
Sure.
videos. You can see also on my Instagram on before and after, and it basically we are not allowed to say certain words, but it actually allows the body to heal.
Mhm.
And from my own experience, after the gallbladder removed, I couldn't eat meat for 25 years. I was vegetarian because I
Oh,
couldn't digest meat.
wow.
Yes, and 2 years after ANF, Dr. Miko said, you either eat meat or I'm stop treating you because you need the foundation, and you're not having
Yes.
the enzymes, you're not having the foundation. And I was like, no, I can't digest. It's stuck in my stomach, and he's like, please try.
Yeah.
And I did. And I'll tell you, I said, why I didn't find this earlier.
Exactly.
And now I can eat meat at 10 o'clock and go to bed, and I have no problem. My 2 pregnancies, I was craving meat like crazy. It fixed my my iron and ferritin imbalance because of not eating meat. I'm always fighting with iron and ferritin,
Yeah.
and so indeed, so like today, it's very hard for me to work without ANF because is truly that we have to give the right frequency so the body can copy and paste and
Mhm.
then learn how to navigate through that right frequency again.
Doctor, you mentioned that you had Theomenia. What is that?
Mm.
It's the first time that I
Um,
hear about it.
Septicemia. Yeah, I had
Septicemia.
it. Yeah, so basically, from the surgery I had at 10 years old, in 2010, I started to have pancreatitis. So creating stones on the pancreas, and no one could find why. I was going through exploratory surgeries and blah, 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 and I couldn't find out. So 2014, they found out that the surgery they did when I was 10 years old it was having an issue. So I had to redo that surgery.
Mhm.
So it meaning having to work again to undo the bypass they did on the duodenum. My bile duct was gone.
Mhm.
But by manipulating the intestine, I end up having that leaking from the intestine material into the peritoneum and the abdominal cavity. And that created a full, very strong bacterial infection, which is one of the biggest cause of death in patients post surgeries and ICUs. So it's basically you have bacteria in your bloodstream in a very high levels. So for those who understand levels, the CRP, which is the reactive protein, should be between
Mhm.
0 and 5. And mine post surgery was at 975.
Oh,
Yeah. So fevers and getting out of my mind, and yeah, I was then
I
very
see. Wow.
complicated. Yeah. And after that,
Okay.
then it of course, as every infection and bacteria in the bloodstream, which can we found nowadays mold, Lyme diseases, and blah 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 that we can talk another time. But it creates an infection, and it leaves, even though and thank God I managed to come out of the septicemia. I started developing something we call fatigue, chronic fatigue syndrome,
Mhm.
which is basically you have no strength for anything. Everything hurts, and the skin hurts, brushing the hair hurts, and that's when I found ANF through um, hard days.
Well, doctor, let's talk about inflammation.
Sure.
How can we, let's say, know if we have an inflammation issue? And if we
Mhm.
do, the causes, how can we fix it?
Sure, that it's an awesome question. So we call invisible inflammation because when you're too inflamed, you go to the doctors and they will give you already diagnosed. They will call you whatever, fibromyalgia, leaking gut. They're gonna call cancer. They're gonna call different things. Now, the trick is how to understand that your body is giving you signs of inflammation, which is bloating, diarrhea, or constipation. And it's very interesting about constipation. Like when we ask patients, do you pass stools every day? And they said, oh, or I said, are you constipated? And they said, no, I'm not. I'm like, okay, so you pass stools every day? Not every day, maybe every 2-3 days. Well, then you're constipated.
Then you're constipated, yeah.
Right? And many people have no idea that you should pass every day. So this is a sign of inflammation, headaches, constantly thirsty, dry skin, pains and aches. And one of the most important things that we ask the patients, like, how do you wake up? Do you wake up fresh? We all should wake up fresh. If we wake up tired, doesn't matter how many hours you sleep, there is a sign of inflammation, and especially a lymphatic system, like your lymphatic system is congested. That thing that patients say, oh, in the morning, it's really hard to close my hands, my joints hurt, my back feels stiff. Well, that is a sign of inflammation. Nauseous, like, oh, I don't know, I have a sickness in the morning, I feel nauseated, I can't have my breakfast, that it's also a sign of inflammation. So are many signs that our body keeps giving about inflammation. Now, how to fix? Food is number one. I would say number two, emotions, for sure. First, we need to address our emotions. Management of stress is a must. We need to relearn nowadays how to breathe. We need to relearn or how to stop. Our brain are so fast that we don't know how to stop anymore. You hear a lot of people saying, oh, I can't sleep because I can't switch off. My brain doesn't switch off. Well, you're inflamed. You're overwhelmed with frequencies that are not balanced enough. So, and so management in stress is a big thing. Meditation, breathing, prayers. I'm a big fan. I'm a big believer that faith, it's one of the biggest healers, if not the most. We have something to believe, and we have something to look after, and bring us hope. Managing stress by breathing, meditating, and then second, food. Like, we have to be very diligent what we put, especially with so many junk foods and foods that are looking amazing, even fruits, like some, in US, you go to US, you see all that beautiful fruits, and then actually when you're going to eat it, it's not as delicious as it looks like, right?
Oh, it has no taste.
Exactly. So, we have to make sure we know what we're eating. We have to make sure that we do good choices. And I mean, you're doing awesome work. I try also to educate my patients in that regards, to avoid. And the main poison foods that we have is sugar, which majority of things have. If you're going to read on the packaging of everything, it's sugary. Gluten and dairy. And it's, again, something that has changed along the days. 100 years ago, bread was the most nutritious food. You have the fermenting, you have all the process. But what happened to the grains and the things they had started to put into our food has destroyed. And so nowadays, gluten is a big issue.
Big factor. So what are the basics that, let's say, people can follow? Changes that they can do to reduce inflammation as much as possible. Let's say I'm one of your patients now. How can you guide me?
Yeah, so basically, first things I said, try to eat everything that doesn't have expiring date. So if you buy a package and you see 2 years of expiring, then you know it's addictive and it's a lot of things there. So try to eat as fresh, buy the local markets, avoid things that also comes through airplanes. And so look for fresh, look for seasonal. It's a bit hard here in Dubai because we don't have that many, but look for fresh. Another thing that I tell patients is about variety. There is very common now, they're talking about this food intolerance test. You're going to become intolerant to everything that you overeat. Oh, I have eggs every morning. Wow, okay, eggs are amazing, but is every morning the best thing? So let's see of your activity. Today you did a bit more cardio, so maybe you can have something different than the eggs when you're doing building up muscles on a lifting weights day. So and yeah, we eat fruits. Try to choose the fruits that are more citric, and the berries. Try to avoid the, I have one patient once said, "Oh, I eat fruits." I said, "Okay, how much of fruits do you eat?" Because I could see his glucose and all the signs of high levels of sugar. And he said,
Yeah.
"Oh, I have about 5-6 oranges per day, or grapes. I love grapes." I'm like, "Okay, that's full of sugar." So so try to stick to natural things as much as we can. The good quality of meat, a good quality of chicken, of fish, variety, plenty of vegetables, leaves. One of the important things that many people do know as well, it's when you're inflamed, try to avoid raw food.
I see.
Okay. So raw food is amazing, and it's the best thing you can have once you have a good gut. When you have a good enzymes to break all that food. When you're inflamed, you don't have that. So you have to help your body to break down. So first step is cook everything a little bit, steam your vegetables, and then eat. So you're already breaking one of the process that your body is having a hard time to do it. And bone broth is another amazing healing, which I normally...
my favorite. I am using it recently heavily.
Yeah, and I normally tell patients, like first thing in the morning, have your bone broth. Half an hour later, you have your breakfast. And same thing before bed, have your mug of bone broth, and then give a bit of time, and then bedtime. So that helps with the lining and this wall, sealing that wall of the intestines. And mainly that, avoid sugar, gluten, and dairy. They're, when you're inflamed especially, they are the bad boys.
Yeah.
Sunlight, yeah, it's another therapy they recommend. So things that we have in nature for free. So make sure every morning you look at the sun. And we come into a culture that everyone have to put the sunglasses and and skin cancer and put sun cream, and then everyone is lacking on vitamin D out of the blue. That it's because we lost the ability to even look at the sun. Of course, I'm not telling you at midday go and stare at the sun.
Stare at the sun.
Yeah, the first thing in the morning, it's okay to do so. We have to be able to look at the sun. And actually, another sign of inflammation is photosensitivity. So you see that patients that whenever I put the red and the infrared light for them at the clinic, they're like, "Oh my God, it's too strong! It's too strong! I can't see." And actually, you should be able to look at your red light.
Yeah. Wonderful. Doctor, I've noticed recently that there are many fixes that are just in nature. And because we tend nowadays to be so disconnected from nature, and it's taking our bodies out of its natural habitat. And I think it's also affecting us when it comes to inflammation.
Indeed. And I grown up in Rio, in Brazil, and to me the beach was always the best remedy for everything. You're not feeling well, go to the beach. You're stressed, go to the beach. And I actually, my body crave for that. And I'm teaching my kids, even my 1 year old, she loves to see the door and just escape to the grass. Because grounding is needed. We are constantly on marble, on shoes, on blue lights, and it's crazy. So indeed, the best remedies are in nature, and we have it for free.
Yeah, wonderful. Actually, if one thing I can, let's say, urge people to do is to be more exposed to the environment and nature outside.
Indeed.
Doctor, can you please tell me about your journey of being a vegan for 25 years? How was it? Because nowadays, when I open the internet, there are big advocates for the vegan diet. So what's your perspective on it?
That's a good question. I mean, I think there is diets and diets. There is bodies and bodies. There is not a cake recipe. Vegan suits for some, but the majority of people that we treat, and we're talking about clinical experience, they do lack. So we see a lot of vegans there, and might not be because they're vegan, but you have to also study and to know how to be a vegan, right? Because we have to have a bit of everything to suit the composition of each tissue of our body. So one of the big problems I had was to put muscle mass as vegan. I literally, and also because my digestion was not greatest, so I couldn't supplement much. Because again, another mistake that I have so much information, I'm gonna throw away everything on you.
Please.
But one of the big things that also it's a big mistake when we're inflamed, we keep taking a lot of supplements and vitamins, and that actually can increase inflammation because you're not even able to digest food. Imagine pills, which a lot of the times are synthetic, because not everyone also will study what is the best and ideal supplementation to have best quality and so on. But back into the vegetarian, this is one of the biggest issue I had as vegetarian was to build up. So I was a triathlete for many years. I did dragon boat as well for many years. I danced all my life, and even though my every time you're gonna check, although sometimes very low body fat, I didn't have a good sustainable muscle mass and definition. Like I was like, I work so hard, why my muscles doesn't have a great definition? And that has changed when I start eating meat. I tell you, I feel much more energy. The naps that I used to need after eating, like especially lunch, I would crash after lunch. I remember like having an hour break between patients, and sometimes I will not even eat much just to be able to have a 15 minutes nap to catch up and having, to be again, to be full of energy again, which I never had to have more naps in the afternoon anymore. So
wonderful. I think because the other day I was reading also that when we are hungry and feeling tired, it's because our body is lacking nutrients. So I myself also have tried being vegan for a while, and it also, let's say, crashed me. Like my energy levels plateaued. I started feeling tired, lethargic, hormones levels dropped. So I tried it for like around a year. It didn't do me good. The minute I started shifting back to meat, that's where I started seeing the improvements bit by bit.
Yeah, it does a big change. I mean, Dr. Miko had the 2 hours lecture for a few years to me talking about the enzymes, and he used to say, I don't care about fish and I don't care about chicken. You have to have a good quality steak. Get a good organic steak once a week, and that's all you need if you don't feel eating more, but at least once. That no enzymes, especially when you're talking about red blood cells. There is nothing you can compare to a good bit of red meat. So since then, I never had issues. I used to live on B12 injections, iron, IV iron, to supplement. I used to do a lot of the IVs with iron, and taking iron, and so trying to balance iron and ferritin was the story of my life. And since then, I haven't had the issue again.
Doctor, let me ask you about fibromyalgia. Is it treatable via ANF?
Yes. And you can see, one of the cases that I'm most proud, and I actually her testimony, it's on my page. I had once a 25 years old. She was a horse rider champion for many years.
Mhm.
She had few bad falls, and she couldn't ride her horse. She started developing body aches, which they
Mhm.
name it fibromyalgia. And she came to me. They said, "Oh, I have PCOS. I have, as I told you, I have." She came with a box full. They're actually giving her glucophage. For
Mhm.
those who know, glucophage, it's to balance sugar in the body
Mhm.
because of PCOS. And I mean, a huge amount of medications this girl was taking, making even harder on her liver, which is one of the
Oh,
main cause of inflammation. It's liver function. And she was, miserable. Headaches, bodies and aches, the typical fibromyalgia protocol. And in 2 months, we were back into the horse. And I just know about her by talking on the phone. I haven't seen her since. So if I
wonderful.
tell, yeah, it's amazing all the things that it can do. Um,
Because
so
I actually
fibromyalgia is
also
one of
had
the
a friend.
easiest.
I had a friend who had fibromyalgia, and he told me that he tried like many treatments and none have worked. That's why I
Mm-hmm.
wanted to ask you about it actually.
Yes, that fibromyalgia is one of the easiest thing to help.
Doctor, what do you think then the role is in medication in all of this? Because like the current day medicine, when you go to a doctor, they immediately just like prescribe you something and they're like, take this, this, and this. And it feels like a momentarily effect only. However, I don't think that they are treating the root cause of the problem. So what do you think about that?
Yeah, this is one of the biggest and deepest sadness I have in my heart, because medicine has become a more pharmaceutical. We studied pharmacy for 1 year. We studied, and we studied in animals. Like we add um, pharmaceuticals to and drugs to the animals to see what happened. So don't take me wrong. Sometimes medication is needed, and I've been there. I had the need of taking morphine, and quite often at that stage, patients with depressions is a chemical issue, and many of them were not going to be able to go and get ANF, and sometimes it's needed. But again, sometimes, unfortunately, medicine turns into a big pharmaceutical thing. So you go there and you live with a bunch of bags. Um, and the medical field has become so specialist in one thing. So you have the endocrinologist, you have the cardiologist, you have the gastroenterology, and we end up losing the ability to see the body as one thing.
Mm.
The endocrine is not working. Why the hormones are not working? How is that liver? How is that pancreas working? Like, how is the pituitary, the hypothalamus? Like, what is the full connection? Why the glands? The thyroid's not working well. Let's gonna have on the HPA axis adrenals. Sorry, and I can't blame only the doctors. I think it's the way that the society, the payments and the amount of money that has to be going through uh, having an hour consultation with a good doctor. Nowadays, you see doctors seeing patients for 7 minutes, and
Yes.
that's all the hospitals allowed. I have colleagues that they had left, and they said, I actually thinking of giving up on this because they don't let me do my practices as I want. The system, especially, we're lucky here in the UAE that we have the ability to sit and to talk and to discuss with the doctors, but some countries, they even having consultations through the phone. So
Very true. It's like in a way, like like the medical system is being shaped by the drive of increasing profit somehow, not by the drive of pushing healthcare, which is sad.
mm-hmm.
Yeah, I see.
No.
Doctor, where do you see osteopathy going in the future? As let's say now it's like a new field which not very well known. Where do you see it going, and how big of an effect could it have in our life?
Yeah, I mean, osteopathic, it's actually old kind of saying, medicine. Unfortunately, is not much seen again because we have insurance that doesn't cover. Um, but thank God, I think people are awakening. I think has been, and after all we've gone through to 2020, I think people are starting to awake and taking a little bit more their health into their hands, let's say. And more people are knowing about osteopathy. And I actually yesterday I had a meeting with a dentist. She's just like, wow, I've been to an osteopath which I didn't know what I was doing there. I was sent it through a friend, and there is no comeback. I mean, I'm telling everyone, and I'm sending my patients, and sorry. And so I believe the future of medicine is also frequency. I mean, there is no doubt. Tesla already said that to us, Einstein. And we're going through that. There is so many nice gadgets nowadays. I mean, that you even get lost. Vagus stimulation. You have the red light, the infrared light, which we used to have in the past, but now it's nanotechnology and so on. So I think we're walking through the right path as well. I just, as everything, we have to make sure we keep on the track. Spreading the word as you do, and as I try to do as well, teaching people. I think the most important that people need to wake up and knowing that it's a world beyond only popping pills for the rest of your life. And a lot of things that I hear, that's how it is. I mean, who doesn't have pain? I hear that a lot. Oh, I have to just learn how to live with this pain. That's not true.
Yeah, like people tend to learn how to live with pain because they think it's the normal thing, which is not.
No, and it's quite sad that, how come you had accept? Yeah, this is one of the things that really breaks my heart. It's sometimes, I mean, I can explain and say things, and I raise my life as a testimony that everything I've been through, I have to go through both. I mean, I was dependent on morphine from the amount of pain that I had. And that was okay for that time. But then again, what was the consequence? To one point, I had rashes all over my body from morphine. It was no longer working on me. So there is a world beyond that we all need to know. And as I say from the beginning, hope and faith, that should always be there, because it is possible. Like, it's impossible to have a healthy body, to live freely, to enjoy nature, as you said, to enjoy the great things that nature can offer us.
Wonderful. Doctor, on this very beautiful note, is there anything that you would like to share from your side before we close up the episode?
I think that's the main message that I would like to to live through the world. I was being told for many times that I was close to death. 1% of my pancreas working, and I'm still here to tell the stories. And so believe, and don't get tired of searching for answers. If this doctor don't tell you there is a solution, go to the other doctor and go to the other doctor. But don't stop believing. And most of all, our health starts here. So if we became a victim of our illness and diseases, then that's it. If we feel sorry for ourselves, which sometimes we do, I mean, we are all humans, but then it's a down curve. So believe, search for answers, and enjoy. Use the natural remedies that we have in the world. Search for help, having someone to walk with you through the healing journey, holding hands. Find a doctor, a practitioner who says we can do that, and go for it. Don't accept pain and aches and as a sentence for life.
Wonderful. Doctor, I'm very grateful and happy that there are people like you out there in the world trying to spread, let's say, tools for people to be better, try to heal, and defy the odds, let's say, in a sense. Thank you so much, doctor, for your time today. I very much do appreciate your time and your experience that you shared with us today.
Thank you, Reda. Likewise, thank you again for this awesome work you do. I'm learning a lot as well to listen to your the awesome people you bring in. So very, very grateful and honored to be invited.
Wonderful. Thank you so much, doctor. You have a wonderful night.
And you.
Bye-bye.
Bye. Bye.